What is polycystic ovarian syndrome? What are the home-based remedies for polycystic ovarian syndrome? How can you treat polycystic ovarian syndrome? On this channel today, Gerard Massa, the health educator, we are going to talk about polycystic ovarian syndrome. Stay with me today, and please, we are talking everything about polycystic ovarian syndrome after this. Thank you for staying with me on this channel, Gerard Massa, the health educator. We are talking about polycystic ovarian syndrome, and remember, we shall begin with the definition. What is polycystic ovarian syndrome? Polycystic ovarian syndrome is specifically an imbalance in the hormones of a woman. When there is an imbalance in the way the hormones are being released in the body of a woman, bringing about changes in her ovaries, then we say this could be a polycystic ovarian syndrome, or it could be a condition also known as PCOS. Now, polycystic ovarian syndrome is characterized by the presence of multiple fluid-filled sacs or cystic growths, cystic areas on the ovaries of a woman. When we have multiple, let us say when we have 12 cysts on each ovary, or even if it is on a single ovary, and this has been seen maybe after doing an ultrasound scan, we say this could be a polycystic ovarian syndrome. So polycystic ovarian syndrome simply means presence of multiple cystic areas or multiple fluid-filled sacs on the ovaries of a woman. When we are talking about polycystic ovarian syndrome, we need to understand how can it be diagnosed. But before we go to the diagnosis, we shall emphasize the fact that in 2005 alone, polycystic ovarian syndrome caused a whole economic burden in the US of over $4 billion. So that shows you how polycystic ovarian syndrome is actually a big issue. So how can you tell that you could be having polycystic ovarian syndrome? These are the signs of polycystic ovarian syndrome. The first sign is there's what we call distribution or appearance of male patterns. There's actually appearance of hair on the beards. There's bearding in a woman. A woman shows hair growing on her lower chin, and then of course there's also what we call acne, and then there's also what we call anovulation or ovulatory dysfunction. You see, you take 3 to 4 months or even up to 6 months without seeing your period. So absence of your menstrual periods for a period of at least 3 to 4 or even 6 months, this could be pointing to a condition also known as polycystic ovarian syndrome. There are many other symptoms, but the basic ones are the presence of male hair-like or the presence of beards in a woman, then also the presence of acne on the skin, and then of course also when there is an imbalance in your periods, then you need to go to hospital to have yourself assessed and seen by your gynecologist or your doctor. So we are talking about polycystic ovarian syndrome. Remember to hit the subscribe button to get many of these new videos I put out every day. This is a health education channel. This information is for education purposes only. Remember to always go see your doctor so that a more personal approach can be given, more personal testing can be done to give you the best treatment. So we are moving on with our topic for today, polycystic ovarian syndrome. How can you tell that you have polycystic ovarian syndrome? What is the diagnosis of polycystic ovarian syndrome? Before we go to the diagnosis, we need to understand the 3 major types or the 3 major phenotypes of polycystic ovarian syndrome. The 3 major phenotypes of polycystic ovarian syndrome include 1. Ovulatory dysfunction, 2, the presence of polycysts or the presence of these growths on your ovaries, and then also what we call high androgen function or hyperandrogenesis. So there are 3 major categories there are 3 major phenotypes of polycystic ovarian syndrome, and these include ovulatory dysfunction, polycystic ovaries, and hyperandrogenesis. When we understand the 3 major phenotypes, when we understand the 3 major categories of polycystic ovaries, we shall understand that it's not always that a woman should have the 3. Actually, even if a woman shows up in hospital and they discover that she is having at least even one of the 3 we talked about, then we still call this a polycystic ovarian syndrome, meaning that when you go to hospital and they discover that you are having what we call an ovulatory dysfunction, when you are having ovulatory dysfunction, your menstrual period is not moving as it's supposed to be, then still it could be polycystic ovarian syndrome, but it could be a milder form. It could be actually in the early stages. The next is you could go to hospital and you could be having what we call hyperandrogenesis, or your androgens are overworking. Then we could say still this is something to do with polycystic ovarian syndrome. Also, you could also be having polycysts on your ovaries, but without the other 2 we talked about. So still, it's always very good to have yourself checked. The first testing or the first check that can be done to discover that someone or to discover that a woman could be having polycystic ovarian syndrome is what we call a pelvic ultrasound scan. The pelvic ultrasound scan will be performed by your sonographer, and normally, what are the features? How can you tell that the scan has showed that yes, this is polycystic ovarian syndrome? On the ultrasound scan report, there's going to be presence of multiple cystic areas. This should be taken into account. This should be taken as a caution, because sometimes when there are maybe 1 or 2 cysts, even 3 cystic areas, this could actually imply that maybe these are luteal cysts or even simple functional cysts. So the cysts that tell us that a woman is having polycystic ovarian syndrome on an ultrasound scan, normally these are supposed to be counted. They normally begin from 12 and over. They could actually be 15, they could even be 20. So when you do an ultrasound scan and your doctor tells you that you have maybe 10 cystic areas or even 15 cystic areas, then this is the first pointer that you could be having polycystic ovarian syndrome. So the first feature on an ultrasound scan is presence of 12 or more cystic areas, and measurement should be done of these cystic areas, and normally when they have been measured, then they are normally between 2 millimeters up to 9 millimeters. When these cystic growths have been measured, when an ultrasound scan has been done, measurement should be done, and normally when they are measured, they range from 2 millimeters up to 9 millimeters. So from 2 up to 9 millimeters, and then they are maybe 12 up to 15 in number, we say this is what we call polycystic ovarian syndrome. The next feature on an ultrasound scan that will tell us that a woman is having polycystic ovarian syndrome is what we call measurement of the ovulatory volume, or the measurement of the volume of your ovary. Still, your doctor or your sonographer will measure the volume of your ovaries, and normally the volume is at 10 mils. So when the volume of your ovaries is at 10 mils or even above, then we say there is what we call polycystic ovarian syndrome. So we shall move on. The next test for polycystic ovarian syndrome, we've already talked about a pelvic ultrasound scan and what normally is shown on the report. So the next test is the measurement of your total, the measurement of testosterone levels in your blood. When a woman is having high levels of testosterone in her blood, then we go back and say there is a problem. Now there are two types of testosterone. There is what we call total testosterone, and then there's what we call free testosterone. So when a laboratory test has been done on your testosterone levels and the levels are abnormally high, then we say this is polycystic ovarian syndrome. And then next is the measurement of your insulin levels. Normally the insulin levels in PCOS, they are elevated. And then of course lastly, it's also very important to measure the thyroid stimulating hormone. Normally it also gives us a clue on what is happening. So the major tests in PCOS include the laboratory testing for testosterone, pelvic ultrasound scanning for specifically cystic areas, and then of course a hormonal profile test or a fertility hormonal screen test. Normally when we talk about the fertility hormones that are involved with PCOS, these include, the first predominant one is presence of high levels of LH or high levels of luteinizing hormone. When there is high levels of LH in your blood, then this signifies that it is a PCOS condition. And then of course high levels or the levels of follicle stimulating hormone, also known as FSH, and estrogen can be evaluated. We have just talked about the tests that can be done to confirm that someone or a woman is having what we call polycystic ovarian syndrome, PCOS. Now, briefly, before we go to the treatment of polycystic ovarian syndrome, it is very important for us to have a small talk about what we call the pathophysiology or the origin of PCOS. Ideally, we were supposed to talk about it in the beginning, but we had to begin with the signs. We had to talk about the investigations. So briefly, before we go to the treatment, the origin of polycystic ovarian syndrome is like this. In the brain, we have key areas that are involved in this condition called polycystic ovarian syndrome. There is that particular part in the brain known as the hypothalamus. Let us be very attentive to this because it actually is that it is a foundation of polycystic ovarian syndrome. In the brain, there is a part called the hypothalamus. The hypothalamus does many functions. It plays many functions in a body. In our bodies, we all have the hypothalamus. Both men and women have the hypothalamus, but specifically we are talking about polycystic ovarian syndrome in women because this is a condition that happens in women. So the hypothalamus plays a very big role in such a way that it releases a hormone. This hormone is called the gonadotropin releasing hormone, abbreviated as GnRH. So the gonadotropin releasing hormone is produced by the hypothalamus. The gonadotropin releasing hormone travels to the anterior pituitary gland, also abbreviated as APG. When the gonadotropin releasing hormone has reached the anterior pituitary gland, there are two hormones that are going to be released. These two hormones include follicle stimulating hormone and luteinizing hormone. I repeat, the hypothalamus releases what we call the gonadotropin releasing hormone, and then this gonadotropin releasing hormone goes to the anterior pituitary gland, and when the anterior pituitary gland receives this stimulation from the hypothalamus, then there are two hormones that are produced. The first is FSH and the next is LH. These are abbreviations, but in full they mean follicle stimulating hormone and luteinizing hormone. When these two hormones, the FSH and LH, have been produced by the anterior pituitary gland, they travel in your bloodstream up to your ovaries. FSH and LH is produced by the anterior pituitary gland. It travels in the blood up to your ovaries. When these two hormones reach your ovaries, what do? When these two hormones, FSH and LH, reach your ovaries, they actually act on your follicles. They cause the maturation and the readiness of your ovaries, or the readiness of your follicles. Follicles are those small parts of your ovary which contain the egg, which is normally fertilized later on during ovulation to become an embryo or to become a viable pregnancy. So the whole process of maturation and growth is brought about by these two hormones known as FSH and LH, which came from the anterior pituitary gland. You remember we talked about that. So if at all we have an egg cell and these two hormones have come in, FSH, also known as follicle stimulating hormone, acts on the inside of your egg cell. That inside is called the granulosa part. So FSH acts on the granulosa, bringing about the production of a hormone known as estrogen. Most doctors call it estradiol. So when estrogen has been produced, then there's going to be also LH acting on the outer layer of your egg cell. The outer layer of your egg is what we call the theca cell or the theca layer. So LH acts on the outside, bringing about the production of a hormone also known as progesterone. Normally when you do these fertility tests, your doctor will give you the request you do these tests, and on these tests you will normally see FSH, LH, you'll see progesterone, you'll see estrogen. I think at this point we've talked about the whole process, how they come about. Next time you see these tests on your fertility or on your report, you will understand that FSH, LH is coming from the anterior pituitary gland, and FSH and LH is acting on your eggs, and when it acts on your eggs, progesterone and estrogen is being released. So basically, to make this more understandable, you should just understand that estrogen is a product of follicle stimulating hormone acting on the egg, and then progesterone is the product of luteinizing hormone acting on the on your eggs also. So what happens is that the levels of estrogen are going to be produced, and when they increase, when estrogen rises, when estrogen levels rise in number and estrogen becomes too much in your bloodstream, there's going to be what we call a negative feedback mechanism happening. In this process, in this whole process, there's going to be actually your anterior pituitary gland was the one that produced the FSH. So when the estrogen levels are high, the anterior pituitary gland will sense this, and then it will cut off the production of LH and then of course and FSH. The whole process of like the production of FSH and LH will be cut off so that the estrogen can be used in the whole process of ovulation and then the whole process of pregnancy if it happens. So how does polycystic ovarian syndrome come about? We've talked about the whole mechanism, the hypothalamus, the anterior pituitary gland, and then the ovaries working in a cyclical order, working in the normal function as they are supposed to be working. When we have luteinizing hormone being produced by the pituitary gland when it is abnormally high, remember what we are talking about? We are talking about polycystic ovarian syndrome. What we've just explained is that brief account of how the whole process of menstruation, the whole process of ovulation and production of the hormones happen. So when there is abnormally high levels of luteinizing hormone being produced by your anterior pituitary gland producing too much levels of luteinizing hormone. We call this polycystic ovarian syndrome, because when there is too much luteinizing hormone in your blood, it means the follicles or the eggs in your ovaries, which were supposed to grow normally, they are not going to grow normally. They are going to become very many, and then they are going to be filled with fluid, and they are going to be called they are going to become what we call cystic areas. So in a nutshell, polycystic ovarian syndrome is simply a result of abnormally high levels of luteinizing hormone being produced by the anterior pituitary gland. That is in a nutshell. So PCOS is due to abnormally high levels of LH. We are talking about the management. Remember, this video is for education purposes only. Always consult your gynecologist or your specialist doctor so that a more personalized approach can be given, but this video is for educational purposes only. It's for information purposes only. This information is so good so that the next time you are told that you have polycystic ovarian syndrome, you have an idea of what is happening to your system. And remember to ask me all your questions down below in the comments. I will answer all your questions, and please, you can also connect with me on my WhatsApp, and my WhatsApp number is +256 701 79 78 and 76. Once again, my WhatsApp number is +256 701 79 78 and 76. So you can ask me, you can connect with me on my WhatsApp, and we can expound more. We can talk more about polycystic ovarian syndrome and even any other conditions related to women's health. So we are talking about the management of polycystic ovarian syndrome. When we are looking at the management of polycystic ovarian syndrome, we need to understand the background. We need to understand the phenotypes or the different types of polycystic ovarian syndrome, and normally once we understand the different types, then we shall understand the management very well. Remember, we said that in a woman with polycystic ovarian syndrome, there is abnormally high levels of insulin, and abnormally high levels of insulin, and when we have abnormal high levels of insulin and LH, two hormones. Insulin is a hormone that is responsible for regulating your blood sugars in the body. It's produced by the pancreas. Normal sugars in the body, depending on the country you're living in and the laboratory readings, but the normal sugar levels are supposed to be free up to 6.5 millimoles. Normal sugar levels are supposed to be free up to 6.5, but in some countries we can get that they say that the normal levels are supposed to be 3.5 up to 7 millimoles. It depends, but you can always have a detailed talk with your doctor. They will explain more about this. So the treatment of polycystic ovarian syndrome basically measures on the different phenotypes of polycystic ovarian syndrome. Remember, we said that there is presence of polycystic areas on your ovaries. There is also what we call ovulatory dysfunction, and when we talk about ovulatory dysfunction, it goes back to the whole thing of FSH, LH being produced. So there's that dysfunction where there's too much luteinizing hormone being produced. So treatment is basically to stabilize that, the levels of LH. And then also the abnormal levels of insulin should also be treated. So in a nutshell, treatment of polycystic ovarian syndrome measures on controlling the sugars, and normally the sugars can be controlled by diabetic drugs used in diabetes, that is type 2 diabetes. So the most common drug we normally use is metformin, and then the most common drug your doctor will use is metformin, and then also the other treatments that can be given are hormonal fertility or hormonal contraceptives. This should be given by your doctor. And then also treatment can also be given for stabilizing the high levels of testosterone. So testosterone can be managed with treatments or drugs given by your doctor. So in a nutshell, treatment is basically to stabilize your sugars, and then also to stabilize your overactive androgens, and then also to stabilize the polycystic areas. The polycystic areas, normally, if at all we are looking at treatment of polycystic areas, normally the treatment which is given is what we call laparoscopic ovarian drilling. Laparoscopic ovarian drilling normally is a procedure whereby they can go into your system, your pelvic region, with an instrument. It's called the laparoscope, and then areas that are producing high levels of testosterone can be drilled, and normally this results into lowering of testosterone levels. And normally when your doctor adds the fertility drugs, for example clomiphene citrate, normally there are high chances that you can conceive or you can get pregnant. But remember, this video is for education purposes. Do not self-medicate yourself. You should always go see your doctor, and then they will prescribe you these drugs, they will prescribe you these treatments, and then of course with close monitoring of your hormones, close monitoring of your laboratory check on your laboratory tests, normally prognosis or recovery can be good. Also, it is worth mentioning about the diet for someone with polycystic ovarian syndrome. You can always get more information from your dietitian about what foods are supposed to be eaten by someone with polycystic ovarian syndrome. But normally we advise that a woman who has been diagnosed to be having polycystic ovarian syndrome should at least exercise a lot. You should have more of physical workouts. You could have more aerobics. You could do jogging. You could skip the rope at least in the morning and in the evening. You do it in sets. You can always contact your physical fitness coach, and they can give you what best treatments can be done. And then also it is worth mentioning that someone with polycystic ovaries should have more of a green leafy vegetable diet. It is very important, because when we go to the dairy products being consumed by someone with polycystic ovarian syndrome, there's going to be addition of weight. And remember, we talked about insulin. So, and then of course estrogen in milk can also bring about the worsening of the condition. So predominantly plenty of fluids. For example, you should drink water, more of water, and then of course exercise more, and then have a diet or a plant-based diet that is more of green leafy vegetables. And then also work with your doctors, and they will put up a treatment plan for you, which is very key in having good recovery rates. So remember, all this can be done, but it's only God who does the healing. So remember to pray about it. Remember to pray to God for healing, because it's very important to put God first in everything we do. So once again, thanks a lot for staying with me for this tutorial, for this lecture about polycystic ovarian syndrome. I hope you've benefited in this lesson. Remember to share this video with all your friends, anyone you know who might need this information. Share this video with them. And then of course, remember to ask me all your questions down below in the comments. I will answer all your questions. And then of course, let me know if you would like to connect with me on my WhatsApp. My WhatsApp number is +256 701 7978 and 76. That is +256 701 7978 and 76. Thank you for staying with me. Have yourself a fantastic and healthy day. God bless us all.